Ladies and gentlemen, diabetes is often called a silent disease for one terrifying reason. Millions of people are living with it right now without even knowing it. While they continue their normal daily routines, high blood sugar may already be damaging nerves, blood vessels, kidneys, eyes, and vital organs inside the body. The frightening truth is that diabetes usually develops slowly. In the beginning, the warning signs can seem so small and harmless that most people ignore them completely. Many assume they are simply tired, stressed, aging, dehydrated, or overworked. But doctors continue warning that the body often sends early signals long before diabetes becomes severe. Recognizing these symptoms early may help prevent life-changing complications later. One of the earliest warning signs doctors often notice is constant fatigue. People with rising blood sugar levels frequently feel exhausted even after getting enough sleep. Some wake up tired every morning or experience low energy throughout the day without obvious reason. This happens because the body struggles to move sugar from the bloodstream into the cells properly. Even though glucose is present in large amounts, the cells cannot use it efficiently for energy. As a result, the body feels drained and weak. Another major sign is excessive thirst. Many individuals with developing diabetes notice they are constantly drinking water, yet never truly feel satisfied. High blood sugar causes the kidneys to work harder to remove excess glucose through urine. This leads to increased fluid loss and dehydration. In response, the body triggers stronger thirst signals. Some people begin carrying water everywhere or waking during the night desperately needing to drink. Frequent urination is another common symptom that should never be ignored. Individuals may suddenly find themselves using the bathroom far more often than usual, especially at night. Doctors explain that excess sugar in the blood pulls additional water into the urine, increasing urination frequency. Some people blame aging or drinking too much water, unaware that blood sugar problems may already be developing silently inside the body. Unexpected weight loss can also be a dangerous warning sign. Some individuals lose weight without dieting or increasing exercise. Because the body cannot properly use glucose for energy, it may begin breaking down fat and muscle tissue instead. While some people mistakenly celebrate unexplained weight loss, doctors warn it can sometimes indicate uncontrolled diabetes. Another early clue is increased hunger. Some people feel hungry constantly, even after eating full meals. The body's cells are essentially starving for usable energy because glucose cannot enter properly. This may lead to frequent cravings, overeating, and constant snacking. Unfortunately, many people respond by eating more sugary or processed foods, worsening the problem further. Blurred vision is another symptom doctors take seriously. High blood sugar can affect fluid levels in the eyes, causing temporary swelling that changes vision clarity. Some people notice difficulty focusing, blurry reading vision, or fluctuating eyesight that seems to improve and worsen unpredictably. Over time, uncontrolled diabetes can permanently damage the eyes if left untreated. Slow-healing wounds are another important warning sign. Small cuts, scratches, or bruises may take unusually long to heal. High blood sugar damages circulation and weakens immune function, making it harder for the body to repair tissues and fight infection. Doctors often become concerned when minor injuries remain inflamed or infected longer than normal. Tingling or numbness in the hands and feet may also appear early. This happens because elevated blood sugar can damage nerves over time. Some individuals describe pins and needle sensations, burning feelings, or partial numbness in the fingers or toes. These symptoms may come and go initially, but often worsen if diabetes remains uncontrolled. Dark patches of skin around the neck, armpits, or groin can also be linked to insulin resistance. Doctors call this condition acanthosis nigricans. The skin may appear thicker, darker, or velvety in texture. Many people overlook these changes because they develop gradually, but doctors consider them an important external clue that blood sugar problems may be developing. Frequent infections are another warning sign. People with diabetes may experience recurring urinary tract infections, skin infections, gum problems, or fungal infections. High blood sugar weakens immune defenses and creates an environment where bacteria and fungi thrive more easily. Some women experience repeated yeast infections without realizing diabetes may be contributing to the problem. Doctors also warn about persistent dry mouth and dry skin. Dehydration caused by excessive urination can reduce moisture levels throughout the body. Some people constantly feel thirsty, develop cracked lips, or notice itchy, dry skin that does not improve easily. Mood changes and irritability can sometimes occur as blood sugar fluctuates. Some individuals become unusually anxious, emotional, impatient, or mentally exhausted. Blood sugar instability affects the brain as well as the body, influencing concentration, mood, and emotional balance. Another symptom many people ignore is brain fog. Individuals may struggle with concentration, memory, or mental clarity. Tasks that once felt simple suddenly seem exhausting. Some people blame stress or lack of sleep, while underlying blood sugar issues continue progressing silently. Doctors often emphasize that diabetes does not appear overnight. It usually develops gradually through years of insulin resistance, poor diet, inactivity, stress, obesity, genetics, or other metabolic problems. During this slow progression, the body sends repeated warning signals that should never be ignored. One reason diabetes becomes so dangerous is because many individuals delay medical testing until severe complications appear. Some only discover the disease after vision problems, kidney damage, nerve pain, or heart issues develop. Early detection gives doctors a much better chance to prevent long-term complications. Family history plays a major role in diabetes risk. Individuals with diabetic parents or siblings should pay especially close attention to symptoms and maintain regular health screenings. Genetics can increase vulnerability, especially when combined with unhealthy lifestyle habits. Diet strongly influences diabetes development. Regular consumption of sugary drinks, processed snacks, fast food, refined carbohydrates, and excessive calories places enormous strain on insulin function over time. The body gradually becomes less responsive to insulin, allowing blood sugar levels to rise higher and higher. Physical inactivity also contributes significantly. Muscles help remove glucose from the bloodstream, but sedentary lifestyles reduce this important process. Regular movement improves insulin sensitivity and helps regulate blood sugar naturally. Even moderate exercise such as walking can make a major difference. Stress affects blood sugar more than many people realize. Chronic stress increases hormones like cortisol, which can raise blood glucose levels and worsen insulin resistance over time. Poor sleep, anxiety, and emotional pressure also contribute to metabolic imbalance. Obesity, especially abdominal fat, greatly increases diabetes risk. Excess fat tissue contributes to inflammation and hormonal changes that interfere with insulin function. Doctors frequently encourage gradual healthy weight loss because even modest improvements can significantly reduce risk. Sleep quality is another major factor. Chronic sleep deprivation disrupts hormones involved in hunger, metabolism, and insulin regulation. People who regularly sleep poorly may develop worsening blood sugar control over time. Doctors strongly emphasize the importance of regular medical checkups because blood tests can detect prediabetes and diabetes before major symptoms appear. Early intervention often allows people to reverse or control the condition through healthier habits and treatment. The good news is that many cases of type 2 diabetes can be prevented or managed successfully through lifestyle changes. Healthy eating, regular exercise, weight control, proper sleep, stress management, and medical monitoring can dramatically improve blood sugar control and reduce complications. One of the biggest mistakes people make is assuming they will feel seriously sick if diabetes is developing. In reality, many people feel mostly normal for years, while silent damage continues inside the body. That is why awareness matters so much. Doctors continue reminding the public that the body whispers before it screams. Constant fatigue, unusual thirst, frequent urination, blurry vision, numbness, infections, brain fog, slow healing, unexplained weight changes, and dark skin patches are not symptoms to ignore casually. They may be early warning signs that diabetes is quietly growing inside the body. Your health tomorrow is shaped by the choices and awareness you have today. Listening carefully to your body's warning signals, seeking medical care early, and making healthier lifestyle decisions can protect your nerves, heart, kidneys, eyes, and overall future health before irreversible damage occurs. Many doctors explain that one of the most dangerous things about diabetes is how quietly it damages the body over time. Unlike sudden illnesses that create immediate severe symptoms, diabetes often progresses silently for years. During this period, blood sugar levels may remain elevated every single day, while tiny blood vessels and nerves slowly suffer damage. By the time obvious complications appear, significant harm may already have occurred inside the body. One of the earliest areas affected is circulation. High blood sugar damages blood vessels, reducing healthy blood flow throughout the body. Many people begin noticing cold hands and feet, leg cramps, or slower healing without realizing circulation problems may already be developing. Poor circulation becomes especially dangerous because it increases the risk of infections, nerve damage, and tissue injury over time. Doctors are particularly concerned about nerve damage, also called diabetic neuropathy. High glucose levels can injure delicate nerves throughout the body, especially in the feet and hands. At first, symptoms may seem mild, such as occasional tingling, numbness, burning sensations, or sharp pains. Some individuals describe feeling like insects are crawling on their skin or experiencing electric shock-like sensations. As damage worsens, sensation may decrease significantly, increasing injury risk because people stop feeling cuts, burns, or pressure properly. The eyes are another major target of diabetes-related damage. Persistently high blood sugar can injure tiny blood vessels inside the retina, the light-sensitive part of the eye responsible for vision. Early signs may include blurry vision, difficulty focusing, floating spots, or trouble seeing clearly at night. Without treatment, diabetic eye disease may eventually lead to vision loss or blindness. This is why doctors strongly encourage regular eye exams for people with diabetes or prediabetes. Kidney damage is another silent complication many people never notice until advanced stages. The kidneys contain millions of tiny filtering units that clean waste from the blood. High blood sugar places enormous strain on these delicate structures. Over time, protein may begin leaking into the urine as kidney function declines gradually. Unfortunately, kidney damage often causes few symptoms early on, making regular medical testing extremely important. Doctors also warn about increased cardiovascular risk. Diabetes significantly raises the chance of heart attacks, strokes, and high blood pressure. Elevated blood sugar contributes to inflammation and blood vessel damage throughout the body. Many people focus only on sugar levels while overlooking the broader effects diabetes has on the heart and circulatory system. Skin changes may also provide early clues. Some individuals develop dry, itchy skin, frequent infections, slow healing sores, or darkened patches around body folds. Poor circulation and weakened immune defenses make the skin more vulnerable to injury and infection. Doctors often emphasize that the skin can reflect internal metabolic problems long before serious complications appear. Another overlooked symptom is persistent fatigue after meals. Some individuals feel unusually sleepy or exhausted after eating large amounts of carbohydrates or sugary foods. Rapid blood sugar spikes followed by crashes can leave people feeling weak, foggy, and drained. These energy fluctuations may signal insulin resistance developing inside the body. Digestive issues may also occur. Some people experience bloating, nausea, constipation, or stomach discomfort because diabetes can affect nerves controlling digestion. Blood sugar instability may interfere with how quickly food moves through the digestive system, leading to uncomfortable symptoms. Doctors frequently discuss the dangerous relationship between diabetes and obesity. Excess abdominal fat contributes heavily to insulin resistance, where the body's cells stop responding properly to insulin. The pancreas then works harder and harder to produce more insulin until eventually blood sugar levels begin rising uncontrollably. This process may develop slowly over many years before diagnosis finally occurs. Many people wrongly assume diabetes only affects older adults, but doctors continue warning that younger individuals are increasingly developing type 2 diabetes due to poor diet, obesity, inactivity, chronic stress, and excessive processed food consumption. Children and teenagers are now experiencing metabolic problems once mainly seen in adults. Sugar-sweetened beverages are considered one of the biggest contributors to rising diabetes rates worldwide. Soft drink, sweet teas, energy drinks, flavored coffees, and processed juices contain enormous amounts of rapidly absorbed sugar. These drinks place intense stress on insulin function because liquid sugar enters the bloodstream extremely quickly. Sleep deprivation is another hidden risk factor many people underestimate. Poor sleep affects hormones that regulate hunger, appetite, stress, and insulin sensitivity. Individuals who consistently sleep poorly often experience stronger cravings, weight gain, and worsening blood sugar control over time. Stress itself acts like a silent metabolic disruptor. Chronic stress increases cortisol and adrenaline levels, which can raise blood glucose and worsen insulin resistance. Many individuals living under constant emotional pressure unknowingly create hormonal conditions that contribute to diabetes development. Doctors often explain that prediabetes is a critical warning stage. During prediabetes, blood sugar levels are already higher than normal, but not yet high enough for full diabetes diagnosis. This stage is extremely important because lifestyle changes may still reverse the process before permanent complications develop. Unfortunately, millions of people with prediabetes have no idea they are already at risk. Another warning sign doctors frequently discuss is increased waist size. Abdominal fat around internal organs is particularly dangerous because it produces inflammatory chemicals that interfere with insulin function. Even moderate weight reduction can improve insulin sensitivity significantly. Physical inactivity worsens the problem further. Muscles help remove glucose from the bloodstream during movement and exercise. Sedentary lifestyles reduce this natural glucose regulation process, contributing to rising blood sugar levels over time. Doctors consistently emphasize that regular movement is one of the most powerful tools for diabetes prevention. Family history remains another major factor. Individuals with diabetic relatives should pay close attention to symptoms and undergo regular screening. Genetics alone may not cause diabetes, but combined with unhealthy habits, risk increases substantially. Many experts warn against relying solely on symptoms because some people develop serious complications with very few obvious warning signs. Routine blood tests such as fasting glucose and HbA1c can reveal blood sugar problems long before symptoms become severe. The emotional impact of diabetes should not be ignored either. Living with chronic fatigue, dietary restrictions, fear of complications, and long-term health concerns can affect mental health significantly. Anxiety, depression, and emotional exhaustion are common among individuals struggling with uncontrolled diabetes. Doctors continue emphasizing that prevention is far easier than treating advanced complications later. Healthy eating patterns rich in vegetables, fiber, lean proteins, healthy fats, and whole foods support better blood sugar control naturally. Limiting processed foods and sugary drinks reduces stress on the body's insulin system. Hydration also matters more than many realize. Drinking enough water supports kidney function and helps regulate blood sugar more effectively. Some people confuse thirst caused by rising glucose levels with hunger, leading to unnecessary overeating. Another critical point doctors stress is that diabetes management is not about perfection. Small, consistent improvements create major long-term benefits. Daily walks, healthier meals, improved sleep, stress reduction, and regular medical monitoring can dramatically improve outcomes over time. One reason diabetes continues spreading globally is because many modern lifestyles constantly promote overeating, inactivity, poor sleep, chronic stress, and excessive processed food consumption. The body was never designed to handle endless sugar spikes and sedentary habits without consequences. Doctors often remind patients that the body usually sends warning signs gradually before major crises develop. Ignoring fatigue, thirst, numbness, blurry vision, infections, slow healing, and unexplained weight changes allows silent damage to continue progressing. The good news is that awareness changes everything. Many people successfully prevent complications after recognizing symptoms early and making healthier changes. The earlier diabetes is identified, the greater the opportunity to protect the eyes, kidneys, nerves, heart, and overall quality of life. Your body constantly communicates through symptoms, energy levels, cravings, sleep patterns, and physical changes. Learning to recognize these signals may help you catch diabetes before irreversible damage occurs. Doctors continue warning that diabetes may grow silently for years, but the earlier you listen to your body, the better your chances of protecting your future health.